everyone, it's Dr. Rick with an unboxing on a medical cannabis product. This is Avexia. I decided to do a couple of these back to back since a patient of mine is having a little bit of a problem and we're doing some experiments. So the last video I did is on capsules. Check it out. I'll try to put a link down below. These are tablets, Avexia. So if you look to the last video, I believe it was just CBN in that capsule for nighttime. It's CBN is one of the cannabinoids, one of the active ingredients out of medical marijuana. This has both, here, 14 to 1 is the ratio. That means 14 parts of CBD, 1 part of THC. And here is the label. I don't know if you'll be able to see that label, but the label should give you the breakdown. Specifically, has tested by the company, required by the government and state, to say how much is in each tablet. So since this is a drug, you have to know exactly how much is in each tablet. So 14 to 1. So if you don't know what that 14 to 1 ratio means, then that's okay. I'll put a reference down below as far as my color coding for the medical cannabis products. So this is Avexia. It was 35 bucks or something like that at the Verilife dispensary in Arlington Heights. And this has in it, it's a bottle of tablets, and here is one. This smells like marijuana. So the last video I did, it doesn't smell like marijuana. The capsules did not, but this definitely smells like marijuana, and that's how it looks. It's kind of tiny. There's also a score. If you can see, there's a score down the center, so you can actually break this in half. So that could be a good thing. If you have a score down the center, you can break it in half and it still will be prolonged absorption, but you just might be able to do half. So this thing, which has 40 tablets, and each tablet is 2.5 milligrams of CBD, if you see that, you might be able to, if it's too powerful for you, meaning you get too dizzy or you have memory issues or you're fatigued in the morning, that means you have to back off. So the way I suggest trying this would be, because of the high potency or high CBD content, this would be, according to my color scale that I adopted from New York, this would be more of a blue or an indigo. Indigo, if you check out my color scheme, is most, if not all CBD. Blue is mostly CBD. And then there's green, which is 1 to 1. That's the ratio. And then there's yellow, which is mostly THC, and then there's red, which is all THC. So that's a color scale for deciding what to buy, because these things are not always available. Sometimes your dispensary might not have it, or sometimes you might switch dispensaries, you don't know what to buy, so you might want to know your ratios and your color schemes. So what I would do with this, because most of my patients are more inflamed than anxiety / post-traumatic stress disorder, for post-traumatic stress disorder, you stick with red, and you just suffer the effects of being possibly couch locked, meaning you're just stuck in a couch and high. But I do have a rescue for that, and the rescue I usually suggest is something like this. So I'm kind of doing 2 unboxings at the same time, but this is Matter, and Matter, if you use it, this is mostly CBD, and it's tincture. You can see the breakdown, but it's nice because if you get overly sensitive to the THC part, if you take a high amount of CBD, whether it's from medical cannabis CBD or hemp-based CBD, it will neutralize further high effects. And I also have a rescue of using lemon and black peppercorn and that together, so check out the video. So the way I'd use this is I would try 1 tablet every night for about 5 nights straight, no other variables during the day, meaning no change in exercise, no change in alcohol, no change in food, no change in mindful practice. Keep on with the same usual routine as far as what time you sleep, what time you wake up, what time you eat, and then after 5 days you say, okay, this is causing side effects or it's not causing side effects. So if it's not causing side effects, maybe you'll go to twice a day for a week after that, watch and see, no other variables, and still no side effects after that. Cool, just push on. As long as you don't have any side effects with the use of this thing, 1 pill twice a day, then I'd say you go for at least 3 to 4 weeks, and then you observe. At that point in time, you observe how much pain you're in, how much your inflammation is still there, how much your rash is still there, how much the headache is still there. After you hit the 3 to 4 week mark, then you can either up the dose or decrease the dose. So that's the way I use CBD to take care of inflammation, pain, headaches, rash. I think it's very important. For rash, I'd probably go topical, but you can still get benefit from this. So to put it in a nutshell, as far as taking care of disease, if it's more of a mental disease, anxiousness, depression, then you want a little bit more THC, red. If it's more of an inflammation disease, autoimmune, Hashimoto's, back pain, fracture, cancer, then you want more of the blue, or CBD. And that's essentially bottom line. Now, the problem is always going to be when you use a product that's mostly CBD, not that much THC, you're not going to notice the effects that fast. Now, there's still a little bit of THC, which is why you have to be careful for the first week. Some of you guys might be super sensitive. And I'll say that if you're doing that first experimental week where you take one pill every night and you wake up and you're still high in the morning, or you're dizzy, forgetful, fatigued, you might want to cut it to half a pill thereafter for a week, no other variables, and you observe how you respond to half a pill every night. And if you don't have any problems with half a pill, that's your dose. And then you go on to half pill twice a day, see how you respond to that. And if you still don't have any problems, then you just push through half pill twice a day for about 3 to 4 weeks, and then you notice how you do with pain, your inflammation, whatever your disease process is. If you overdose, go to the Matter, take about a dropper full of this stuff. Some of you who are super sensitive, you just might just do this. Do this every night and see what this does, but I'm just using this as a rescue. So that is the way I would use Avexia. I'm sure other dispensaries probably have other Avexias. Avexia is nice because it's a tablet and you don't have to take the oil. Some people don't like oil. You don't have to vape. I don't really like vaping, but if you have to, fine. I don't suggest you burn the flower, smoke the joint. I just don't like burning leaves and inhaling that. I think you're asking for trouble. So this is just another option. So hopefully you have good results with this. If you are not cleared for a medical marijuana card, you might want to come in and see if you can qualify for it. If you don't qualify for it, then you can probably go with hemp. Hemp is also very good. I have a very good contact in West Dundee, Entourage Clinical, and Kaylee is excellent with her knowledge base. She has very high standards and she carries good product. So you might want to go that way if you don't qualify for medical cannabis. Otherwise, check out your dispensary. Ask them if they don't have it, say you want to try tablets, so maybe they can order it special for you. And give it a try. So if you have any comments, please put them down below on what your dispensary has and maybe what works for you. Again, this is more for inflammation, but you can get some benefits from just CBD stimulation at night. You might be super sensitive and it might work for you. Remember, CBD is the workhorse of the receptors in the body. There are actually more receptors for CBD than any other receptors, whether it's epinephrine, estrogen, testosterone. CBD is found with Israel studies to be the most profuse receptor found in the entire body. So there's ways that if you use this properly, you might be able to reset the way your cells work. As far as cancer, we're seeing the results, and at least from outside the US as far as the studies, but hopefully with the leniency towards accepting medical marijuana, medical cannabis has a true treatment plan. We'll see more research being put out, but it probably won't be for the next 5 to 10 years. I'm doing some limited studies with my patients, just anecdotal, to see how they respond, and so far, spectacular. My older patients have to be careful. That's why I want to give these guidance protocols for how to introduce, what to do to rescue, and how to push through and see if this is the thing for you. So if you have any comments, put them down below. Otherwise, I'll see you at the next unboxing.